Good day, everybody. My name is Makinie Fortino. I'm a licensed marriage and family therapist, a mom, and also the CEO and founder of Deconstructing the Mental Health System, otherwise known as DMHS. Usually, what I do is an annual report where I run through all of the numbers and our progress, our successes. That video is usually 40 minutes to an hour. And I will say, now I'm running on mom time. I can do about 10 minutes, 10, 15 minutes. But it's also, I think, really good to just kind of do reflections on, what the year has been like. Because if I'm being real with you, coming back to work postpartum, I felt like I showed up about a month too early. And I was in this space of, there was a fork in the road of scaling back services and just focusing on the directory, or scaling up, just depending on if I could get support or not. And to be completely honest with you, I didn't know what was possible in February of 2025. I honestly thought that it could go either way. And I was telling my husband, I'm like, I think we need to prepare for, either me to transition to being a full-time mom or winding down DMHS. Like I was in, I will say, a very unhealthy mental space. The postpartum experience was extremely hard for me. But we were blessed with Best Start for Kids, um, selecting us as one of the grantees for the Centering Diverse Healers Grant, which is focused on keeping people in the field. So it felt like a very full circle, timely, like, don't stop this work yet moment that feels really good. And because of Best Start for Kids, so many other beautiful things happened. So with that, I'm just going to go ahead and tell you a little bit about how the year has been. What I will say is that this is not the official report. These are just reflections of how the year has been and some of the work that has happened. And yeah, some of the work that has happened this year. Um, One thing I'll say about DMHS, and maybe I've said this in videos before, I'm not sure, but I will say it again here, is in the beginning, our organization was founded from a space of like desperation, of consolidating resources so that when people reached out to therapists and said, I need to find somebody, I need to address my racial trauma, I'm really worried about my family, et cetera, they could find a safe provider who would more than likely not lead to increased trauma or racial trauma in attempting to provide the services. And at that time, we were really also trying to get diagnoses like racial trauma and post-traumatic slave syndrome recognized in the DSM, because the hopes were that basically a more educated society is a safer society. And while that is true, in this particular context, giving someone an additional diagnosis does not necessarily lead to better results when it comes to racial trauma in and of itself. There was that, and then there was also the recognition that a lot of organizations back in 2020 that were, they were doing public apologies and, basically like PR tours and all of that turned out to be really performative and have since moved on from recognizing things like racial trauma. So with that combination, in addition to just conversations that I've had in community, we've reached a point, and it's reflected in our mission as well, that we're recognizing that we actually are very well resourced when we have the tools, when we have the access, and sometimes when the funds are available to us. We're really good at healing and supporting ourselves. And that is really what the work is about this year. So as I was saying, I was really thinking about scaling back DMHS, but we ended up scaling up by some miracle. And you really, through the support of Seattle Foundation and Neighbor to Neighbor, as well as Best Start for Kids, we were able to grow our organization by 3 staff members this year. So we have the wonderful Joyanne Joseph, who focuses on payroll and admin assistance. Letty, who has been with us for a few years, helping with gathering data and surveys. We have also added Shayna Spoor, our clinical director and of the free therapy and wellness program, and Taquisha Dean, who is our training and events coordinator. And these two have just I actually cannot say enough about all of the amazing work that they have done. In less than 2 months of starting her work, Shayna was able to clear our 2024 waitlist and get us into 2025. And then, in addition to that, make additional referrals well into 2025. And that happened in less than 2 months. She also designed our internship program, and we were able to recruit Comey, who is our very first intern, who is currently designing a youth program for us, which I never would have dreamed of. I certainly not would have dreamed of back in February or March of this year. And Taquisha Dean, you probably recognize her face. Taquisha has been our PLLC cohort. She co-created it and also led it for the last 3 years and has now transitioned into coordinating trainings. And with the Best Start for Kids grant, she ended up coordinating 4 trainings, 2 events, and 2 consult groups in the span of like 4 months. It's just amazing the work that they have put in. And if I'm being completely honest, we are underfunded. So a lot of the work that they're doing is volunteer based, and I honestly cannot thank the team enough. When I was talking about this just a couple of days ago, I found myself in a space of being very close to just like breaking down and crying and just remembering the feeling of, oh my gosh, I might have to let this organization go. From going from that to just blossoming into this amazing team of dedicated people who really care about the work, have a lot of experience, and are tapped into community. In addition to that, we have 4 amazing volunteers. We have 3 board members, and then we have over 40 free therapy and wellness providers. So in 5 years, we have been able to get 500 individual listings of medical and mental health, cultural wellness providers who identify as people of the global majority or queer and trans affirming or identifying providers. That like I keep talking about almost crying, but when I approved that 500 listing, I sat there for about 10 minutes staring at my computer screen because I really couldn't believe that we had reached this place in just 5 years. Because when I tell you that year one, I was knocking on doors, I was like, please, we're small. We're really just trying to get a bunch of people to add their listings so that people don't have to go to a bunch of different places to find providers. Please consider listing yourself and begging. And there were 3 people who took a chance on us, and we went from 3 to 500. And I honestly am just amazed at the just the variety of experience, how people are so like rooted in the culture and the services that they provide, how much they care about their clients and how much they trust us to list them in a way that is respectful, in a way that like dignifies the work, and highlights the fact that we are not afraid to be political in the sense that our color makes us political. Our very existence, and it's safer for us to see and work with each other. Our DMHS free therapy and wellness program continues. We continue to partner with local and state organizations. We continue to partner with Young Women Empowered and Powerful Voices, Renton Technical College, and we're in conversation with a few other organizations, so hoping to have more partnerships in the future. Our free therapy and wellness program is almost 50% of our providers identify as Black. followed by 25% Asian Pacific Islander and 13% Latina. We have over 40 providers with over 70 specialties in cultural health and wellness services, from somatic processing to trauma work to Reiki, and so on and so forth. We're in 10 states currently and provide services in 4 languages. This is another area where, that started with about 3 or 4 of us doing, we were providing the service, but it was also an exchange for supervisors to provide, basically to volunteer supervision services so that associate therapists and trainees could get the experience and the hours that they needed to graduate and to work towards their license. But now we've grown to a place of we're able to serve over 50 people a year, which feels really good. There are some highlights. Like I said, this is reflections. This is not necessarily even going to be in the report, but these are highlights that are really important to me that I wanted to share this year. Um, So this year, actually last year, there were about 5 of us who have either like collaborated with or work in DMHS who became pregnant and had children. Um, we have Claudia here from Get Us All Counseling with her baby, and that's the top right, and then at the bottom, that's me with my baby. We're out at the Powerful Voices Healing Justice Summit that we co-sponsored this year. And then we also have the Guess That Groove flyer, Calvin Pepra, who has been basically volunteering, doing like community connection, community networking, mixers for the last few years. Like I said, on a volunteer basis, we were finally able to just reach out and be like, hey, we would love to sponsor this. We know that you're going to do the work anyway. You might as well be paid for it. Same goes for Erica Cherry, the center bottom photo right there. The wonderful Erica, who has been doing Black Therapist Consult for the last 6 years, I believe, on a volunteer basis. We let her know that we wanted to recognize her work by sponsoring it financially. And so now she's being compensated for that work. And then on the far left, we have Dr. Phoebe Bracco of 253 Therapy and Consult, who hosted our year 3 Washington State approved supervisor training. But what she said that I thought was really beautiful was this is actually our year 1, because this is the first year where we're independently hosting the event. So it's a partnership between Dr. Phoebe and DMHS. And not only that, we believe that Dr. Phoebe was actually was a huge milestone for Washington State in and of itself, because I don't know of any Black woman doctor facilitated Washington State approved supervisor training. So this was a first in so many ways, and in her words, a day 1 for our organization and this partnership. And like the activities that I was describing, from We Mind, We Matter to Black Therapist Consult to Washington Approved Supervisor Training, were all this year sponsored by Best Start for Kids. So again, thank you so much for that support. It helps us be able to connect with and support community care that we know is going to happen with or without funding. Also, I gotta say, Dochi recognized us, which is just so cool. She has a website, anxietyiswatchingme.com, which is a mental health resource directory, and it includes our organization under the intersectional category, which I think fits really well, because we recognize that, especially for communities of color, there are so many intersections of race, gender, socioeconomic experiences, religion, and so on and so forth. And because we recognize that there are many pathways to healing. It's not just going to be the mental health model, and nor should it be. It could be community care, it can be wellness groups, could be somatic processing, and so on and so forth. And to be recognized for that work is just such an honor. But more importantly, our clients also recognize that the work that we do is, not to be hyperbolic, but especially at this time, has the potential to be life-saving. There are so many people who are reaching out for help and being on the receiving end of trauma. There are stories this year of, for example, a woman who was pregnant, who her body was kept alive even though she was deceased because the medical team decided that that she was basically going to become an incubator, that her fetus was more important than her dignity. And just last week, there was another story of a woman who had to give birth in a waiting room because her pain was not recognized, because they didn't care how much pain she was in. These are the things that we are trying to actively interrupt. We recognize that people feel safer when they feel seen, when they feel not just understood culturally, but literally feeling seen by the person who is providing services. So this client said, working with my provider has been such a grounding and validating experience. As a child of immigrants, I often feel like I'm carrying so much that's hard to explain, but with them, I didn't have to over-explain. They just got it. Having a therapist who shares a similar cultural understanding and sees how systems like capitalism, white supremacy, and institutional barriers affect our mental health made me feel deeply seen. Our sessions didn't just focus on fixing me, but on naming the very real external pressures that impact how I move through the world. It made therapy feel like a space of liberation and not just coping. And that there's really not much more to add to that. That is really what the work that we do is about. Finally, I'm gonna close out here. Like I said, these are just reflections of highlights of the year. There's so much more that has happened this year, but these were the pieces that I really wanted to share with you. Please keep an eye out for our annual report that should be coming out in the next few weeks. In the meantime, I'm going to make an ask and encourage you considering making monthly donations. So if you are considering making donations, we strongly encourage monthly donations because there's work that is ongoing and we need support for that. But there's also the annual option as well. So for monthly donations, $30 covers the cost of a monthly directory listing. $150 covers the cost of one free therapy or wellness session. Anywhere between $150 and $450 a month covers the cost of wellness workshops. But there are also annual donations that you could make instead. $350 covers the cost of one annual DMHS listing, and $1,800 covers the cost of 12 free therapy and wellness sessions. And it's usually kind of a package deal for the clients that receive services. So when a referral is made, the referral is made for 12 full sessions. So it would be really helpful if you could support the full 12. But honestly, there is no like limit. Right? If you only have $2 a month, that is more than enough. If you have 1,800 a year, we're also really grateful for that as well. But we do ask that the commitment be a monthly commitment. So think about what you are able to contribute on an ongoing basis, and whatever your comfort level is based on that. We have the donation QR code right here. I've also just added the link below the QR code for those who do not want to use the QR code. Again, I would just like to thank you so much for being here, for taking time to watch this video, for supporting DMHS, if you are a supporter, for partnering with us and continuing this work. Because if there's one thing that I think is becoming very clear for many of us is that the harms out there aren't going anywhere. We are at risk of being profiled and persecuted at any minute. However, we see each other and we can support and help each other, and the work doesn't have to stop, regardless of what those that would perpetuate harms against us think or believe. We can be here for each other, hopefully for an extended period of time. So I'll stop there. Thank you so much, and I will hopefully see you next year.